My computer is freezing. Okay. So Brianna Harris Henderson is the founder and CEO of Let's Talk PPCM, a patient advocate, certified patient family partner, and doula. She is also a wife and mother of 2 children. She was deeply inspired to provide comprehensive prenatal and preventative education after serving a missed diagnosis during her pregnancy and postpartum season. After recovering from her acute health condition and learning what took her sister's life, Brianna dedicates her life to ensuring that mothers and families are informed during their perinatal year. She fulfills the heart's mission through professional doula support and her nonprofit organization. And with that, it is my honor to introduce Brianna Henderson. Thank you and welcome.
Hi, everybody. Thank you all so much for having me today. It is a pleasure to be able to always bring awareness to peripartum cardiomyopathy. And peripartum cardiomyopathy is an often unrecognized and misdiagnosed form of heart failure that's found in pregnancy. And as a result, the heart becomes enlarged and the blood can no longer pump through the rest of the body. So in 2013, studies had showed that 1 in 1,300 women develop peripartum cardiomyopathy in the United States every year. Okay, again, this is in 2013. So of course now we're in 2022. So I'm pretty sure that data has, changed drastically. And we're still waiting on continuous updates. As a result, many women die from not being properly diagnosed in time. We now know that the sooner PPCM is detected, the higher the mother's chance of making a full recovery. PPCM is one of the leading causes of maternal mortality in the US. Okay. And this is something that we didn't really know of until we kind of got involved into the advocacy work. A simple blood test could actually save new mothers. And this blood test is called the BNP blood test. And what it does is measure the levels of a protein called BNP that is made by the heart and the blood vessels. So BNP levels are higher than normal when a woman has heart failure. Okay, our 501c3 nonprofit organization, Let's Talk PPCM has created a PPCM screening exam that can increase the chances of sooner detection in women with unknown PPCM genetics. So PPCM is a genetic disorder that women don't even know that they're carrying. Okay, so data is collected for medical and informational purposes on our behalf. We do provide a training or a special training for the screening exam as well. And everyone can learn about that on our site, let's talk ppcm.org dash ppcm screening. And also a BMP test is recommended for moms with high blood pressure, if they've ever experienced with high blood pressure, preeclampsia, if they've ever been diagnosed with preeclampsia, multiple births. So just having multiple births, because it could happen on either the first child or it could happen on the fifth child. It could happen on the ninth child. I mean, it just doesn't matter which child. It could happen long as like if a mother experienced multiple births. Heart murmurs, any mom that has been diagnosed with a heart murmur, ever had one. And I know hypermissive, that's a disease or some type of vomiting illness that women is called HG. So we have found out that it's some sort of link that can be there with HG as well for PPCM or a risk factor. Fertility treatments. So we found out that fertility treatments can be linked to having PPCM as well. And then also just a family history of heart disease. All right, so we do offer this a life-saving 25-minute service where mom is greeted by an actual doula, which is myself, and then our FNP, which is our family nurse practitioner. And we just kind of screen the mother of any type of, a certain questionnaire that we have. And then we also go into getting a blood draw and then taking that blood draw and going to get it tested just to let the mother know or to be at peace to know that she, is not candidate or at risk for PPCM. Okay, now since PPCM is considered rare, doctors aren't watching for it. Okay, so which is, that means that the actual number of the cases may be higher than what we know. Okay, let's talk PPCM. We do accept tax deductible donations to offer free BNP blood tests and postpartum exams for moms who develop risk factors for peripartum cardiomyopathy. And we also just had our awareness week approved by the Texas governor to have our own PPCM awareness week, May 10th through the 17th. So we're excited to celebrate that. So now that we mentioned all that good stuff, what I did want to mention today is about how I even got involved in this work. And how I got involved in this work is okay, around the time I say I was expecting my second child, and me and my husband, we was definitely excited. It wasn't nothing out of the ordinary or anything that could go wrong. I wasn't at risk for anything. I had a normal first pregnancy, so I just assumed that everything would be good and gravy for the next pregnancy. Um, but during this pregnancy, I did experience more prolonged morning sickness. Like the morning sickness lasted all day. It wasn't just no morning sickness that was in the morning, it would last throughout the day. I remember complaining about it to my obstetrician. Like I probably got to like the 5th month. I was like, oh my goodness, I'm still vomiting. And I didn't do that the first time. She was like, oh, well, it's just, that's, probably normal because it's multiple pregnancies. It's different, that brings on different, reactions. And so, of course, I didn't think anything of that. So when we got to about 36 weeks, and I'm starting to go through my prenatal checks weekly, I had noticed there was a flutter or something in my heart. It was something that was, it was alarming to me. I could feel it. It felt like it was bubbles or something in my heart. And it wasn't a constant bubble feeling. It was like kind of just, it let me know that it's there and then it'll go away. So I did bring that up to my 36 week visit. And I remember, her checking the baby's heart rate and everything. And I said, I know you don't normally do this, but if you can, I said, could you, check my heart for me? Because I feel like, something weird going on. And so she thought it was a little weird. I could tell because, by her facial expression, but she listened to me. She was like, yeah, I'll check your heart. And I was like, thank you. So she did. And she said she heard a murmur. She said it was a harmless murmur. So she was like, this murmur, it'll go away after the birth. I wouldn't worry too much about it, and she sent me on my way. And so I didn't worry anymore about it. So come to time for labor, I end up going into a severe hemorrhage 10 hours after birth. Uh, what happened in between that 10 hours, I wasn't really educated on what was happening to me and what was going on at that time. During that time, I do remember, her taking at least 30 minutes to remove my placenta. I know that did not happen the first time. So I did not know what happened, what was going on this time. But I did ask her, because I felt like it was taking too long and I couldn't hold my baby while she was, trying to get me set up and everything, trying to remove the placenta. And, by the time she had it removed, I was relieved. I didn't think anything else of it. I was like, okay, everything is great. Oh my goodness, but no, 10 hours later, I end up having like a lot of blood started filling the pad. So I would go and change the pad. I changed at least 5 within 1 hour. I did not know that this was not normal at that moment. I wasn't told to be aware or maybe look out for possible signs of hemorrhage or anything like that, even though it took 30 minutes and stuff was kind of doing differently around this time for my pregnancy. And me and my obstetrician, we had a connection going on. So I was like, well, I trust her, everything is fine. But yeah, so I went into that hemorrhage. It took 5 hours for them to stop the bleeding. They, came very close to having to rip out my uterus because they almost couldn't see where the bleeding was coming from. So that part was just scary in itself. And, it took the anesthesiologist, after they woke me up and everything, he came and let me know pretty much everything that had happened to me. And everything was kind of just moving a lot fast. during that week. They did readmit me in the hospital just to be able to monitor the bleeding and everything. And things started calming down. They readmitted my daughter as well because it was about time for us to check out. I think around that next day, so they went ahead and kept both of us. And after I mean, the actual last day before we got discharged, I had asked my obstetrician because she had came back to visit me for that last time, to make sure everything looked good. And I asked her, I said, I know this is not normal. I said, but I just want to know if my heart is okay from going through that. Because I mean, I had just, I went through the flutter. So it's like, well, I just want to make sure my heart is fine. And so she was like, okay, she was like, yeah, that's fine. We'll do that. I mind you, this is something she don't normally do, but we had, I felt like we had a good enough connection where like, I'm just trying to make sure I'm okay. And so she was, okay with that. And so she had them bring up this echocardiogram on the L&D floor, and they checked my heart. And so by the time it was time to get discharged, she came in, she let me know, hey, everything's good. Your heart is fine. Cough was just kind of like yeah, the cough was kind of like a cold, I would say, or maybe a flu-like symptom. I thought, and then I have bad allergies as well, so I just kind of linked everything up to that. Um, but what happened was, I was I was slowly coming down with whatever it was, and I think two weeks passed, 4 weeks had passed, all the way up until 6 weeks passed. So at 6 weeks postpartum, here I am. I'm about to get ready to, have my 6 week checkup, and everything was I thought was going fine up until this point. Besides me having this irritating cough and kind of gaining weight a little bit, which I thought was healthy weight. Thought it was, me gaining weight from the actual pregnancy, and I didn't think anything of it. Other than that, that actual year, it was around Christmas time. So Christmas Day, because I had her November 8th of 2016, and this was December 25th of 2016. And so I had went to my gathering, and my dad noticed that I didn't look good. He did let me know that I didn't look good. I looked at very sick, and so he was concerned. So he ended up giving me some sinus pills, to take while I was there. I did take them. I didn't feel any relief, of course, but I mean, you have to take medicine over and over again to kind of feel some type of relief, right? So that's what I was just gonna wait on. That night when we got home, I could barely make it to the door. My husband had to actually kind of help me get into the house. And once I did, from the parking lot to getting in the door, I literally had to just fall out on our couch. I felt like I was so out of breath. I tell him, I said, oh my goodness, it felt like I just ran, to the door. Literally, I just walked. I only walked to the door, but it felt like I was running. And so after I had caught my breath on the couch, I pretty much started getting ourselves ready for bed that night. I remember pumping. I made a lot of milk. So I was pumping that night. I pumped at least every 2 to 3 hours. And around, I think about 2 in the morning, I would say, of the next day on the 26th of December, I asked my husband to come in there to listen to my heart, because I told him, I said, it sounds like it's beating so fast, and he listened and he said, yeah, he said it's beating fast, and I was like, I said, well, maybe it's because I'm pumping. I was just trying to make, something. I didn't know that something could be going on. I just thought that, um, hey, my heart beating fast because I'm pumping or something. Like I just made it up something to calm myself. I didn't want to think negative. And my husband, he's not a negative thinker either, so he didn't want to think anything bad. We were just like, oh, it's from the baby, or having baby is fine. Anyways, I left it alone. It was time for me to go ahead and lay down. I laid down, and I literally felt like I was underwater. Like I couldn't breathe at all. And if anyone knows how it feels to hold your breath underwater when you're under there too long, that's exactly how I felt with just laying back just a little bit. So I had literally had to pop back up just to sit up till I could breathe. So at this point, I'm like, oh yeah, this is a bad sinus infection. Oh my goodness, it's really bad. I can't even breathe when I'm laying down, you know. And so I just leaned over because my husband, he was asleep. He had to work that morning, so I left him alone. Baby girl, I was, you know, having her up and down, but I was still able to, you know, take care of her as far as until like a couple of hours that actual same day. I couldn't really hold her because I was out of breath, so my husband had to kind of just um, help me with that because it was getting like bad. I was, you know, slipping away slowly. And I remember texting my dad, and I let him know that I couldn't breathe, you know, while laying down. I didn't get no sleep, you know, and I because he knew I was sick that day before, so he was like, you know, Bree, that doesn't sound normal. You need to go to the hospital. You know, it sounds like it could be pneumonia or bronchitis. And I was like, I said, I go to the doctor, you know, Thursday. Here it is Monday. I said, I go to the doctor Thursday, you know, for my PP exam. I'll be fine until then. I just let her know. And he was like, no, I don't think you need to wait, you know. And so my dad being him, he ended up coming to get me. You know, we was able to, I told my husband, go ahead and go to work that morning. And my mother-in-law was able to keep baby girl. And then our son, he was at his grandmother's as well. So that was, they gave me the time to be able to try to at least find out about myself, you know, to check on my health and what was going on with me, since normally everything is about the baby. Okay, so we got there, they did notice that my vital signs were abnormal. They saw my oxygen levels was at an 82 and dropping. My blood pressure was high. I know it was at least 152 over I think 93, I believe. So it was like it was not normal for me, you know. And here I am. I was 23 at that time, and you know, 2 months postpartum. So at this point, they didn't know that I had a baby. The only thing they did know is I was shortest of breath. So that's what they marked me down as. So since I was shortness of breath, they said that, oh well, we take this, you know, seriously when people come in shortness of breath, but we're gonna have you wait because we're you know, short of staff, and we have a lot of you know, people waiting to get X-rays and CTs. And so I'm like, okay, you know, I'm out of breath, but I'm like, okay, you know. So we finally get in line to get an X-ray, you know, me and my dad, because we're sitting there, we're just waiting. And after we do the X-ray, they said they had to send us back into the waiting room. So we had to go back into the waiting room for 2 hours, and we just waited there. They said they had to wait on a room. So finally, they got us a room. We was able to go back, and at this time, I think it took about probably 30 minutes for the doctor to actually come in. He had the chart already. They had already did the x-rays, and he was like, look, he said, you got fluid, you know, over, we see fluid that's covering your heart and your lungs. That explains why you can't breathe. He said your heart, you know, was also enlarged, you know. And so me and my dad was looking at each other. We was like, what? You know, like we just last heard this information 3 years ago when, you know, my sister had passed away. And so the doctor, you know, was like, yeah, I see in your file your sister died of a cardiac arrest. And, you know, and my dad was like, yeah, and she died, you know, she had a baby, you know. And my, you know, my daughter, my other daughter, she just had a baby, you know, like that. And so, you know, the doctor was like, oh, you just had a baby. So the doctor wasn't even aware that I had a baby. I didn't know that you had to actually tell them that. So yeah, so the doctor found out like that. Oh, she just had a baby, so he marked that down in the notes. Um, and from that point, he said that, you know, they had to admit me because of course they had to run more testing to see what was going on. And they did. They sent me, they sent up a echocardiogram. I remember that night. And I told them, I said, I already did this. You know, I said, I did this already. My doctor, my obstetrician said everything looked great. And they was like, well, you know, they want us to do it again. And I was like, okay, you know, so they did. It took 24 hours for me to see a cardiologist. So 24 hours later, after that, then the cardiologist came in And just, I didn't really think anything of it. I didn't think it was going to be anything crucial, serious. I really just thought I was going to get antibiotics and be gone. That's what I was hoping for anyway. I was ready to get back home with my family, so that's what I was thinking about. But he comes in and he says, you're so young. And I'm like, yeah, I know, and I'm on this heart floor. They had me on a cardiac floor because, at this point, they know there's something going on with my heart. And he says that I'm the youngest patient on the floor. So mind you, I'm not thinking about any of that. I'm just thinking about my baby ready to go home. So the next thing he says is, I noticed that you just had a baby, about 2 months ago. And I said, yes, I did, and he said, yeah, and I see in your file you had a sister that, went into a cardiac arrest. And 3 years ago. And I said, yeah. And he said, did she have a baby? I said, yeah, she did. I said she passed away like 6 months after the birth, and I'm like, here I am 2 months after birth, and I'm in here with shortness of breath, And so he says, yeah. He said, okay. He said, well, there's a condition called peripartum cardiomyopathy. And, he said, I'm going to diagnose your sister with this condition as well as you. He said, I feel like you're suffering from peripartum cardiomyopathy, also known as PPCM. And he explained it to me. And I told him I never heard of that before. Why is that not told to women, or why wasn't that something in a pamphlet or something, and he said that is, rare. It was known as rare. So a lot of doctors probably won't, they can miss it. It's easy for them to miss. So with that being said, I'm, on Google, I'm trying to search, I'm looking at stuff, I'm trying to figure out what is this peripartum cardiomyopathy. I'm like, I never heard of it before, and so as he's telling, me and my dad, he's trying to coach us through things, and we like, well, we know, we thinking to ourselves, it's not finna end good. We already been through this. It was a crisis all over again. It was a whole tragedy all over again, but now we had a name for it, because at 3 years prior, we didn't even know what happened to my sister. We just knew that we was going off what they said, and they said that she was, what they called it a natural cause, even though she was 27 years old when her heart stopped. But they called it a natural cause, and that's what they ruled her death as. So my cardiologist, being, so nice, kind-hearted, the guy that he was, he was able to actually get in my sister's file that she passed from PPCM instead of a natural cause, not knowing exactly what happened. And then that also helps with data along the way as well. So with that, he told me that it was a chance, or I had a 50% chance to survive. And he said, but we was going to do everything that we could to reverse the condition. And so I was like, I said, it can be reversed. I'm asking questions because I'm like, no, I remember, half attacking the nurses, when my sister was in the hospital, not finding out. And they wasn't, I felt like they wasn't trying to find out good enough what was going on with her heart, so here I am now reliving in her shoes, and 10 times now, because now I'm literally living as, the treatment and everything. I had to go through everything, process. And he gives me my treatments. My treatments was cardiac rehab. I had to go to cardiac rehab. And with cardiac rehab, what you're doing is they're trying to strengthen your heart by making you exercise. And oh my goodness, it is very difficult because you're already out of breath as a heart patient, and then they're making you exercise. So that was a difficult process, but I was getting through it. It was hard having actual a support system or support team is, on my end, because I had already had lost my sister and my grandmother, and then I had lost my mother when I was younger. So I didn't really have a strong support system. I really just had the close immediate family that I have, which is my own, and my dad, of course, and uncles, auntie maybe. Other than that, it was a very small support system. So I couldn't get the treatments. I couldn't keep going to the cardiac rehab. So I eventually had to just kind of start doing my own routine at home. That's just what helped me. They did remove me from breastfeeding. I could no longer breastfeed. They told me that because of the medicine that I had to take, I wouldn't be able to breastfeed, and it broke my heart because I just knew that I was going to be, doing this for the long haul. I was very dedicated to milk. I made so much milk. I had a lot of milk. So it was very devastating for them to tell me that I was going to have to draw my milk. And that was because of the medicine. So it wasn't like I could donate it or anything like that. They had to actually help me dry my milk in the hospital because I was in pain. They had me on hydrocodones, tried to get this milk out of me. It took me and two other nurses. We were just sitting there squeezing the milk out. I'm not sure if that's how you're supposed to do it, but that's how it was done for me. Okay. And mind you, they still running tests on my heart. I'm on medication at this point. And then they do bring up the life vest. So I end up getting prescribed this life vest. And what the life vest is it's a wearable defibrillator, and they put it on, heart patients who done experience heart attacks or strokes or anything that kind of could cause a, a cardiac arrest. And so the vest is supposed to shock you if you go into a certain rhythm. And so I had to wear that for 7 months. I do remember going through that with my sister. She did have to wear the life vest as well. And unfortunately, when her heart stopped, it didn't bring her back. And so with in my case the life vest was very different. I remember asking the cardiologist, I was like, why it look like that? I said it looked like that when my sister had it. And he was like, oh well, it's been 3 years. He was like, the treatment process has changed, the medication has changed, and the devices has changed. And I was like, just in 3 years. And I'm like, wow, that sucks, because I mean, just 3 years prior, maybe my sister didn't get, the right treatment option that she could have had, because at this point we are now learning that those doctors weren't aware of what PPCM was, and or peripartum cardiomyopathy. They wasn't even aware that that was a condition. And that was at a larger hospital here in Texas. That was a larger hospital, and here I am at a smaller hospital. My doctor is very familiar with it. He says that he get at least 2 patients a year with it. And they don't know the cause. They didn't know the actual cause. They just know that it was a genetic form that happened in random women, and they don't know the women that carries it until the woman comes in there shortness of breath, swollen, maybe have a heart palpitation, heart murmur, and that's pretty much like the symptoms that, and she may have a cough, a dry cough, I would say, because the cough is it's not phlegm. The only phlegm you would probably get is probably pinkish or reddish, maybe some blood may be in it. And that's just if the more severe that the symptoms get. So like if I would have got checked probably 2 weeks when I had experienced that cough, then maybe I probably would have, known that my heart function was low. So fast forward to now at the organization, what we're doing is trying to create the data that's needed now for the BNP, trying to see if the BNP will be the best, sooner detection that we can use, at least to help mothers rule out, or at least know that, hey, it wouldn't be heart problems or heart complications or anything that they will have to worry about if they experience, the HG or fertility treatments, just the risk factors. They have preeclampsia. That's a common one that everyone pretty much knows about. So if preeclampsia is a risk factor for PPCM, why isn't that told to mothers who've been diagnosed with preeclampsia? I mean, it's kind of becoming an issue because I didn't have preeclampsia, and some people be like, oh, because of the medicine or whatever they use during labor. Well, my sister, she went natural. Her birth was very different from mine. And my nephew came out within 3 pushes, and she didn't have the medication that I had. So I couldn't blame it on medicine or something that, was used. It was just something that was unheard of. This condition was just unheard of. They just didn't know to watch out for it. But now we know that the BNP test can actually sooner detect the protein that's needed to let the doctors know, hey, she needs to be reevaluated or get evaluated by a cardiologist, just to rule out any, hard cardiomyopathy signs, or something like that. So with that being said, I end up staying on the life vest for 7 months. I got off the life vest. The medication, fortunately, it was working for me. The difference between that situation was my sister, her body was rejecting the medication. Mind you, this was different medication that they was using, trying to treat it. So three years later, which is now me was dealing with it. That's what they was doing, trying to see what medications would help, my body, or would react with my body. And so they did. They let me know that everything was looking good. They had me there for about a week, and then they sent me on home. After those 7 months, my heart function didn't increase to what my doctor wanted it to be, my cardiologist. And so he wanted to go ahead and get a ICD defibrillator implant. So I did have to get an implant. I did not want to get the implant, but it was just one of those things where my heart didn't recover in time, and so I had no choice but to go ahead and get it, which is kind of a good thing. My cardiologist was more so wanted me to get it because of my sister's situation, not knowing exactly which way this was going to go. Mind you, he gave me the 50-50% chance, so he didn't know if it was going to be 50-50% which way. And so with that, I had to literally, pull myself together. I pulled myself together. I didn't want to be in no pity party. I didn't want to be sitting there crying all every day, just, oh my God, I don't know if I'm going to live or not. I really didn't know what to do. So after my last month, I would say at cardiac rehab, the nurses thought that it would be interesting to bring the news on board to get the story out and to air it. And so I was like, what? It was just shocking to me because they was like, well, no, we never, heard of this before. And we definitely need to get awareness out for it. So I was like, okay, and they brought the news in. So I was on NBC5. They came out to the hospital, filmed me exercising, and then, letting people know that this was a condition that women don't know about, but it's happening. And from that point on, I would say that's when I actually stepped into the awareness journey. So it was kind of brought to me or handed over to me, I would say, because at that moment I didn't know what to expect with my life. I was, I would say I was terrified at the same time, but I was also kind of prepared because I remember watching my sister do the things that she had did. So I was also kind of having to go off of what we did with her to kind of help me out as well. And just in my treatment process, I was like, okay, I just know I'm gonna try everything. Let me just try everything, see if it helps. And fortunately, thank God that yes, things started working well for me. My doctor started noticing that my heart was increasing in function. He called it spontaneous. He said it was just a spontaneous recovery. I ended up fully recovering 2 years later after my diagnosis. Your heart function is normally supposed to be 55% to 60%. When he diagnosed me, it was 15 to 20%. I believe my sister's was around 11%. So mine was rapidly dropping and going into that same direction. And had I not went to the hospital when my dad made me, versus me either trying to wait to get to the doctor that Thursday that I was trying to wait because I was like, no, I'm gonna see my obstetrician. The obstetrician wouldn't have been able to help me with a heart problem. So it's just being able to shine a light and bring awareness to peripartum cardiomyopathy, because women don't know about the condition. I mean, I didn't even really know about hemorrhaging. So if I don't really know about hemorrhaging, even though I think that's like another common leading cause of death, in pregnancy or postpartum, that is still not something that dawned on me when I was sitting there bleeding out, filling up those pads. So I don't know exactly what kind of would have been the better approach, but I think for me in my case, maybe if birth is taking too long or longer than usual, or something is just different from the first time, or that the second time is just different from that previous pregnancy. I feel that women should be able to ask questions, and then also being assured that they're actually getting the proper answers needed and not just kind of just brushed off. I don't think that's what happened to me. I don't think that it was a racism thing at that time. I don't look at it as that, but I do remember when my obstetrician, when she heard that I was on the cardiac floor, because she had a nurse friend who ended up letting her know, hey, we have one of your patients on the cardiac floor. And she said her heart just, dropped. Well, she said her heart dropped because she was like, oh my goodness, that's Brianna. She was like, Brianna been telling me, she's been worried about her heart. She was like, she's been asking me questions. So she got up on that floor and she just came and hugged me. And, she was just like, I'm so sorry. She was like, I didn't know. I didn't know. And I was like, it's okay. I said, I didn't know. I didn't know either, but I said, now I know why, the Holy Spirit, my intuition telling me, hey, check your heart, check your heart, but even in that, I would say, even in the checking my heart, um, it was still, it still was kind of a almost too late matter, because I didn't, if I wasn't aware to ask her those questions or anything like that when I was getting ready to be discharged to have the echocardiogram, she wouldn't have known to do it. But when she did it, we didn't see no problems. So if we didn't see no problems when I got out the hospital that day, and then 2 weeks later, I started developing certain symptoms of heart failure, and it was just unknowing that I was actually developing these symptoms. But had I probably got a BNP blood test done in that, that time frame, just maybe they would have saw, oh my goodness, her levels, are higher than what they're supposed to be. We need to get her examined, for, cardiologist and see, so that is pretty much what we're trying to do, now. And, we're going into this very dedicated about getting the awareness out that's needed globally. This condition is actually, I think it affects 1 in 300 women in Nigeria and in Haiti as well. So it's a lot of women or a lot of mothers that's going through it in the African American race, and also just the African race period. So we do know that it affects Black moms more so than any other race, which is another reason why we have to, raise our voices and being able to explain and share the information on why it's important to learn about PPCM. A lot of women maybe feel like it's, scary, and it is. It can be. It's definitely a frightening condition, especially when you get hit with it and you didn't even know anything about it. I just wish that I would have known something about it, or I wish my sister, would have known anything about it. Um, and I'm just, trying to, we're coming up with stuff, new stuff every year. So we're trying to figure out, so that the project that we do have this year would be the free BNP blood test and the postpartum exams, which is what we're trying to do. And then also with the screening, we do have a screening available on the site. I was explaining that earlier about the Let's Talk. If you go to letstalkppcm.org, and click on PPCM screening, you can find out a little bit more about the screening. And then also with the test, we have a screening exam assessment on there. And for you to actually get involved in that, it's a course that you can take for training. And we have that set up for birth workers to be able to kind of get a wolf of what we're doing. I think it's very important to get something out as far as having a screening, and not just even a screening, but the actual test that itself with the BNP blood test, so people could kind of be more familiar with either hearing that or knowing that they can ask for it. We do have mothers that have asked for the BNP and they do get denied, or they get told, you're not a candidate for heart problems. Why do you need that? They're kind of, you know, not really heard on why they should get the BNP. So we're definitely trying to educate more families about, pretty much how to go about that. And one of the things I would say is definitely having either organizations to be able to help in that field, in that area, because it definitely, we have to bridge the gap. And that's what I'm like so big on, is bridging the gap with that, because I feel like what we're doing now would have saved my sister life. With is what the passion came from on me trying to do this in the first place, trying to see what could have been done, to save her life, and then not only that, but to prevent me from having to get an ICD implant. We do have mothers that have to get heart transplants. I mean, it's a 19-year-old we have that had to get a heart transplant because she went into heart failure unknowingly because of PPCM. First baby, okay, 19, okay, now, and then we have a 16-year-old, who experienced PPCM. Again, unknown, unheard of. Fortunately, yes, her doctors were aware of the condition in order to diagnose her. So that's another thing that we're also trying to do. So we do work with the healthcare professionals and being able to make sure that they're educated on what to look out for, or certain signs to look out for. And then, just also listening, like my obstetrician, just being that listening ear and, okay, my patient wants this done. I don't know why, but maybe we should do it. Let's look into it a little more, because she did that, that assured me that, oh, this woman cared about me at that time, at that moment. Um, and she did her best to make sure that I was heard, and me advocating for myself. So I did pretty much everything right, and obviously she knew that I had lost a sister of a cardiac condition, so she kind of understood why I was asking those questions. But for a mom who doesn't have that history, but she can be, the carrier of it if she had the genetics and she doesn't know, and she done became pregnant. And then, later she starts to experience, certain symptoms, maybe she had prolonged morning sickness. Hello, ding, ding, that can be a risk factor for PPCM. So at this point, it's like, okay, for these women, starting off with these women who's, at risk, how are we able to coach them on, hey, this is a condition, because you was diagnosed with HG, or because you was diagnosed with preeclampsia, this is a condition called, PPCM, that you may need to be aware of. Not saying that it will happen, just something to be aware of, because this condition can bring on the cardiomyopathy, and which is the peripartum cardiomyopathy. So that is my presentation for today. I really thank you all for having me, and I hope that we continue to save lives, and that this taught you guys something. Thank you.
Thank you so much, Brianna. That your story, wow. I had no idea. Like I know I teach students, nursing students, about kind of the changes that the heart goes through, and I don't think people realize how much work the heart actually does to maintain a pregnancy. Your heart is under a significant amount of stress, and then you add having the potential for another complication to that. It is a recipe for a disaster. You are at your most critical when you were birthing a baby. Although we get something beautiful in the end, I think it's kind of understated how at risk you are just from being pregnant, because if you're older in your pregnancy, your heart has to work harder. So that puts you more at risk. So there are definitely risk factors that people need to be aware of. I'm just curious, did you ever go back and have the testing done? Would it have been valid if you did it after your pregnancy?
The echocardiogram.
No, the what is the test called?
The BNP.
Yes.
They end up doing a BNP. They did the BNP after I went in for shortness of breath. That's when they ran a BNP, and it was up there. It was sky high. I believe my BNP was 1600. A normal BNP is 100 and below, or below
Wow.
100. Yeah, and so mine was
Wow.
1600. Yeah, so it was just rising, and it could continue to rise. I know some women it'd be 2,000 through 3,000, so it could just going up as their heart is severely damaged. And then it also depends on the severity of the damage. Like mine's was able to be reversed, my sister's wasn't, and then
Mm.
also in my case, the medication worked for my body. In my sister's case, the medication did not work for her body. So it's like
Mm.
it's a game of trying to find out what is the actual treatments. They still don't know the cause, but they do think that it's the prolactin that's being released in the breast, as
Mm.
the breast milk is forming. They're feeling like it's something that's being released through one of those things, I believe, that provides the milk, and it somehow curves and goes back into the heart. It's very interesting. It's an interesting study that they're doing.
Yeah,
But
I would love to read more on it because it's definitely something I'm very curious about. There
yeah.
was a question in the chat about policy for doing the screening. Now, do you have your own screening or policy or protocol that you utilize for screening, or is there an existing protocol that people could read more about if they'd like to learn more?
Yeah, so we do offer that. It's under our organization, with the actual screening that we had came up with. And what it is a questionnaire that we ask the providers that's treating the mother, who they're feeling is at risk for PPCM. Like I said, if they have those risk factors that I stated earlier, as in like the preeclampsia, they know, because that's probably one of the most common ones that you would
Mhm.
see. So if you know you have a mom that has preeclampsia, that would be a mother that you would more so would probably have screening for.
Okay.
And you guys to actually get access to that, you will go on the site. We have actually a pre-recorded course for it, and then we also provide just a workshop for that as well, or just
Okay.
a training for people to kind of get. Because first, I want to be able to coach you through what it is, why we're asking the certain questions, so the healthcare provider or the birth worker can be familiar with, okay, this is being asked because of this, to kind of connect the dots on why we are asking this certain question and
Gotcha.
how it can actually save that mother's life, or at least sooner detect a complication, because maybe it's not PPCM, but maybe she was at a cardiac, maybe it was another cardiovascular disease that probably happened, or maybe you know came or approached yourself during pregnancy. You know how some of those
Mhm.
that you'll have, and then you
They
don't know.
reveal themselves often during pregnancy.
Yeah, so I think having a BNP exam, tests are done to be able to actually see where their levels is at, and then to even know where your levels is at before, probably wanting to become pregnant, or if you already done been pregnant before, kind of just see. If you could see where your levels is at, if it's 100 and below or under 100, you're good.
Right.
It's good. But then also we want to be able to try to see, okay, is it happening? Because with myself, I had prolonged morning sickness, but I didn't get a heart flutter until 36 weeks. So if I got a heart flutter at 36 weeks, well, nothing really happened to my heart by the time that I was, getting ready to be discharged. And
Hmm.
it kept me for those extra few days. It still showed that nothing was wrong with my heart. But when I did get my results, I actually went and got my paperwork this year from the hospital, and it did show that my heart function, I believe it was the systolic heart function, it was decreased already at 45%. But that
Wow.
should have been told to me when she said that, hey, everything was good, it was normal. I should at least been aware that, hey, your
Right.
systolic is a little bit off, but something like that. Maybe that probably could have helped, and probably would have got a sooner BNP. But if I would have got a BNP, maybe it kind of would have let her know.
Okay. And so someone else is asking, how early in pregnancy should someone request this test?
So I would say definitely around towards the end of pregnancy. We do have a cardiologist that he's very familiar with this condition, and he suggests that around 36 weeks, a woman should be able to ask for it. Hopefully, the obstetrician listens to her and let her, go ahead and just to clear her mind, give her a peace of mind to know that this is not something that she's dealing with, or she's not at risk, or have any levels that's concerning or anything like that. So I think anything 36 weeks to 6 weeks postpartum.
Okay, that helps. Thank you. And then I just have a question about insurance. I know you said some doctors didn't want to do the testing. Is it because just they don't want to listen, or is it more like insurance won't pay for it unless there are certain risk factors?
With the insurance, I believe some insurances do pay for it. I have read across that some insurances do pay for it. It's just some of the obstetricians, either maybe it could be extra probably to them in their area of work at
Mm,
that time. It just depends on the actual provider, because my obstetrician listened to me. She did, probably if I would have known about a BNP test, I'm pretty sure she would have did that, but she did went above and beyond. She did the echocardiogram, but it still didn't catch what it should have caught. Had we probably tested my blood levels first to see,
right,
oh, it's something traveling in her blood flow, but it hasn't revealed itself yet. But let's see after she had this baby. Okay, let's see the next 6 weeks after she done
mhm,
had this baby, so that, but how will we know that I was that risk factor? Well, there wasn't anything that happened to me.
right,
So the other thing that happened to me was hemorrhaging, prolonged morning sickness. Which is why we go back to HG. I wasn't diagnosed with HG, but it was the symptoms that I was having. The
right.
prolonged sickness. So that could have been a connection or a reason for her to go ahead and run a BNP just to see,
Mhm,
where the levels are at. And I probably would have saw the levels change. Probably would have went from 100 to, oh, it's at 5,000, so it's like,
right.
mhm.
Now, I'm also curious about between you and your sister, because they're such a rare condition, and then to have two in the same family. Did they ever identify any type of genetic connection as to why that happened to both you and your sister?
My cardiologist was shocked at that when he noticed that. He said he never seen it in the same family before, so this was new to him.
Mhm,
But he did say that it was a genetic disorder. He said just like cancer. My mom died of breast cancer in 2006, so he was like that was a genetic disorder that she had. She had a rare form of breast cancer,
mm.
in her milk duct. So
Oh,
that
wow.
was, yeah, that was a genetic trait that she had. So that's something we had to watch out for as we got older, a genetic trait. Now with the PPCM, it's a genetic trait,
Mhm.
something that women don't even know that they might have or to look out for. They do have genetic testing available. So like women are now able to get genetic testing for that if they want
Okay.
to know. Yeah.
Okay. Does anyone else have any questions for Brianna before we let her go? I've shared her information in the chat, so please feel free to connect with her and support her organization. She's doing amazing work. You're in Texas, right?
Yes, ma'am. Thank
Okay.
you.
All right. Well, we thank you. I don't see any other questions. We thank you so much for your time. I know I will personally be reaching back out to you as I've said, because we've got some work to do here in Jersey. As I said, we've got number 5 is cardiomyopathy here in New Jersey, and preeclampsia is right with it. So we've definitely got some screening and work we need to do here.
Absolutely. Thank you all so much.
Thank you. Have a great day.
Thank you.
All right, everyone. So we are now at the lunch hour portion of our event. You are free to take lunch on your own. And then you may rejoin. We're going to have the second half of our event will start at 2 o'clock. That is when we will do the section on breastfeeding peer counselors. So you can either hang out here still in the same link, or you can go out and rejoin at 2 o'clock, but we will resume the rest of our day at 2 o'clock. Thank you.